Have you ever heard of Dialectical Behavioral Therapy, otherwise known as DBT, but weren't sure what it is? Well, stick around because that's what I'm here to discuss in today's video. I'll go over questions such as what DBT is, who it benefits, why a psychiatrist or mental health practitioner would recommend DBT, its effectiveness, the cons of this treatment modality, and how to get started. Hi, I'm Jordan Travers. I'm a licensed clinical psychotherapist and the clinical director of Awake Therapy, a non-subscription-based online therapy platform. If you're interested in learning more about me and the Awake Therapy team, you can click on the link in the description box to learn more about us or to book a free initial consultation. So let's jump right into it. DBT is a treatment modality created by Dr. Marsha Linehan in the late 1980s, and it was first created to help individuals with borderline personality disorder, otherwise known as BPD, and those who struggle with suicidal ideation and a history of self-harm. DBT has been shown to be an effective treatment modality for many other disorders too, including bipolar disorder, attention deficit disorder, anxiety, depression, eating disorders, OCD, PTSD, and substance use. In fact, Dr. Linehan discussed in her book, Cognitive Behavioral Treatment of Borderline Personality Disorders, that she had first created DBT because she herself suffers from BPD and wanted to create a treatment modality to help patients struggling with self-harm and overwhelming emotions and suicidal ideation. So you might be wondering, well, what specifically is DBT and how is it different than other therapeutic treatment modalities? DBT is a type of cognitive behavioral therapy that focuses on helping patients stay present in the here and now, learning how to recognize, manage, and change maladaptive thoughts along with overwhelming emotions so patients can improve the relationship they have with themselves and others. So what makes DBT different than CBT? Well, DBT is different in that it is specifically made up of 4 main skills that all patients work on during their course of treatment, which includes mindfulness, which is practicing complete and total awareness of the present moment, distress tolerance, how to manage difficult or painful situations without changing it, interpersonal effectiveness, how to ask for what you want and need while learning how to respect others' boundaries, and emotion regulation, an action plan where you learn how to decrease unwanted negative emotions and learn how to change them. And does it work? Yes, it works. DBT has been shown time and time again to be an effective treatment modality. However, it requires time, commitment, and in many cases, financial resources, which is what some might consider a con of this specific treatment modality. Because when I say it's a commitment, I mean just that. It is a complete commitment that takes typically around 6 months or more, depending on the complexity of the patient, to complete. And it's important to note that while there are many clinical therapists like myself who are trained in DBT, a true DBT experience is much different. These components necessary for having a true DBT experience include 1, a skills training group that typically meets for 1.5 to 2.5 hours per week, where patients learn new behavioral skills and would receive homework to practice implementing these new skills in their daily life. 2, individual therapy once per week for 60 minutes to help clients process their emotions and apply the new behavioral skills to their daily life. And 3rd, phone coaching to help guide patients in managing a difficult situation or distressing symptoms. So let's say hypothetically, your current provider or providers are recommending you enter a DBT program, or you've been recommended to enter a DBT program in the past. What does that mean? Well, the truth is that patients recommended for DBT treatment often have many problems happening in their lives simultaneously. And DBT is used to address problems based on the order of their severity, using a team-based approach, meaning that you would work with many different therapists during the course of your treatment. So if DBT is something that's been recommended to you, or it's something that you're interested in exploring, there are a few ways to find a DBT provider near you. One option is that you can Google Behavioral Tech, which is a resource created by Dr. Linehan that provides you with a directory of DBT providers and resources in your state. Or option 2, you can look up providers using Psychology Today's Find a Therapist search function to see if there are DBT certified or trained therapists near you. Thank you for taking the time to watch. I hope you found today's content both helpful and informative. Make sure to subscribe to my channel to receive updates when a new video is posted. And remember, platforms like YouTube are a wonderful resource for getting information out to others. However, it does not take the place of individualized psychotherapy. If you're in need of mental health assistance, whether to talk through an existing issue or to create a more prosperous and fulfilling life, you can book a free initial consultation using the link in the description. I look forward to speaking with you soon.